I am Anne Greenwood, Primary Care, Digital First and General Practice Nurse Lead for Lancashire and South Cumbria ICS. I have over 30 years experience in both the NHS and private healthcare sector. My current role is to support transformation of primary care and the adoption of a digital first approach to enhance benefits for patients and for the system. There are a range of national and local policies to support digital transformation within the NHS. The NHS long-term plan commits that every patient will have the right to be offered a digital-first primary care by 2024. This requires both technology and a workforce with the skills and capability to respond to the changes with huge benefits to patients and to the system. Demand for primary care services is increasing, and with constraints on time and resources, alternative solutions need to be embraced. Increased numbers within the population have access to smart devices, and these can be used to support enhanced care delivery. Digital technology affords the opportunity to increase access and deliver more responsive care for patients. Collaboration and listening to patients and stakeholders has enabled Lancashire and South Cumbria to implement an online consultation platform across the whole of the ICS, which has also the ability to provide video consultations. This platform has been supplemented by a total digital front door triage solution, which allows 24-hour-a-day access for patients to an online symptom checker and provides direction to the most appropriate service or clinician for their immediate health or care needs. Through single point of access, patient care has been able to be more responsive and accessible for patients. Video consultations, introduced prior to COVID-19 and offered mainly by GPs and general practice nurses in primary care, have provided flexibility for staff to work remotely and enabled hard-to-reach patients to contact a clinician and prevent deterioration of a health condition. Video consultations, as a result of COVID-19, are now a general part of regular practice. Video group consultations have also been successfully introduced and are supporting patients to share experiences and learn from each other, with the result of increased confidence to self-care and manage their own condition. In order to make best use of the technology available, Lancashire and South Cumbria have developed the skills and competencies of the primary care workforce through the commissioning of a number of action learning set programmes. As a result of these programmes, a range of animations have been developed by the digital champions, and these, together with the use of social media platforms such as Facebook, have been used to promote public health messages both in general practice waiting rooms but also on social media platforms and practice websites. These messages have been shown to increase the uptake, for example, of cytology screening. In one practice, there was an initial 10% increase as a result of the campaigns. This has since risen to a 25% increase in cervical cytology screening attendance due to the posting and advertising on the practice Facebook page. The use of approved apps from platforms such as Orca has allowed patients to have the access to up-to-date rated apps and guidance to support the management of their long-term conditions 24 hours a day, and this has had a huge positive effect. Clinicians have the confidence to use apps from approved sites such as Orca and use apps and animations to support patients to improve, for example, inhaler techniques. Digital photography is increasingly being used to improve the quality of referrals from primary to secondary care and to track wound healing rates. This has resulted in improved quality of outcomes for patients and a better use of resources, as a picture paints 1,000 words. Clinicians are regularly using SMS text messaging, for example, to send messages to patients via the online consultation platform to remind patients, for example, to attend for their flu vaccination. The adoption of video solutions and collaboration tools such as Microsoft Teams, Attend Anywhere and the Viscon Clinic units, as pictured in the slide, have enabled virtual MDT meetings to take place across primary and secondary care, with the benefit of joint care planning with patients in real time. Where workforce pressures have occurred due to COVID-19, virtual clinics have been able to be arranged without the need for GPs having to travel from one practice to another to cover. And, for example, the skills of specialist nurses can be utilised across multiple sites without any need to travel. Recruitment has also been undertaken virtually when face-to-face meetings have not been practical. This has ensured that the best candidates are selected for roles within primary care. Virtual meetings and training are now the norm, which have helped to reduce the carbon footprint and increase productivity and efficiencies. Recruitment, retention and resilience of primary care has been enhanced through the use of digital technology and the many programmes and projects that have been introduced across Lancashire and South Cumbria. Digital technology has the opportunity to transform primary care and the way services are delivered for the benefit of all, and there are a number of examples in the slide. The future in Lancashire and South Cumbria is to build on the progress made to date, continue to promote a digital by default approach and start to expand the use of remote point of care testing and artificial intelligence to support remote diagnosis, for example. To continue to develop the workforce and support change management across the whole of the workforce and use data and digital technology to target interventions for the most vulnerable. Thank you.